Welcome to Medicine Talk ND Live, where you can discover life without medicine. Join us live 12 to 1 CST every weekday, where you can talk to a naturopathic doctor for free and learn more about naturopathic medicine. ND Live is brought to you in partnership with FullScript, the doctor's choice for delivering the safest source of professional-grade supplements to their patients.
Hi everybody, Eli Camp here with Medicine Talk ND Live. We're discovering life without medicine. And we thought that it would be really great if you had a chance to hear from all of these awesome naturopathic doctors who give their time every month, be on the phone to talk to you, answer your questions, help you figure out if naturopathic medicine is a good path for you to consider in your journey to health. And today, we have Dr. Alicia Cole with us, who has a practice in Seattle, Washington. Welcome and thank you for joining us on this awesome wintry, blustery day.
Yeah, thank you, Eli. No, I'm happy to be here.
So, I think folks out there are really curious about, why do people become a naturopathic doctor? How do we find naturopathic medicine? Can you share your story with us?
Yeah, for sure. I think the stories are varied. Absolutely. In my undergrad studies, I was sold on becoming a veterinary medical doctor and, veterinarian. And I thought after years and years of being in 4-H that I wanted to be a large animal doctor. And I started shadowing veterinarians and was really disillusioned about that lifestyle. But I thought, I kind of, my path got diverted and I wanted to go into environmental medicine because I thought about the health of the planet, health of, the different species on the planet. And through that, I was introduced to a naturopathic doctor in California. And this was right back around, maybe 2000, when naturopaths weren't even licensed in California yet. And so there were not very many. And I thought, wow, this is so cool that they're really taking care of the planet through their medicine. And I visited Bastyr University here in Seattle, and the remarks made by Dr. Pizzorno, who did the visitor's speech that weekend, he was talking all about that, how we can change the health of the world and the planet kind of one patient at a time by, talking about diet and lifestyle and how to live, more gently, basically, on the planet, and in the same time have wonderful, health benefits for sure. So I decided that's the direction I want to go, and I graduated from Bastyr University. Now it's been 6 years that I've been here practicing in Seattle, so it's been great.
Wow, that's awesome.
Yeah.
So animals. My granddaughter wants to be a vet. It's also talking about she's 7, but she seems so determined and so focused to do this.
Yeah, it's a calling for sure.
I think so. Yeah. We bought her, what's the name of that famous English vet?
I was just thinking of James Herriot. I was just thinking about him.
We bought her some books by him, and she was mesmerized.
Yeah.
So
I read those growing up too.
Did you?
Yeah.
I wonder sometimes if, publishers get together with industry people and say, we need to rekindle interest in this profession.
Yeah, right. Re-release them all.
Tell us about your practice.
Yeah, I have a solo practice here in Seattle, and I'm a primary care doctor, which is great. And I love to see, or the people that tend to find me are mostly women. I do a lot of women's health, endocrinology, hormones, everything from thyroid and adrenal to pre-diabetes and diabetes and things like that. I love working with athletes as well. I have personally, I have a history in athletics, rowing, and triathlon, and so that's a passion of mine. So helping athletes meet their goals is something I, strive towards and encourage patients to come to me for that as well. So kind of a mixed bag, but again, because being a primary care doctor allows you to see the acute stuff as well as the chronic disease as well. So yeah, so love my practice. I would say my practice is kind of middle of the road in terms of the types of modalities I use. I certainly use nutrients and herbs and all of the educational pieces of lifestyle modification. I don't have a lot of space just because it's myself to do, treatments that take a lot of time, like constitutional hydrotherapy and things like that. But I certainly can refer out for those wonderful, healing modalities as well. So.
Right, right. Yeah, when I had my practice in Florida, I couldn't do the constitutional hydrotherapy because we're not licensed in Florida.
Oh, right.
As ND. So I found anyone and everyone around town who could possibly do this, and convinced a few people, a massage therapist actually, for training with me so I could refer people for that.
That's great.
Awesome. So, we've asked all the doctors, and I ask you, what is your favorite herb and why?
Yeah, I wonder how many have said this, but I think for me, because I deal so much with women's health, and one of my big go-tos right now is Vitex or chaste tree berry. Any woman that's having problems with her periods, regulating them, or PMS or dysmenorrhea, which is like cramps and things like that. Vitex is great for helping reduce those symptoms and regulate periods, but then also for fertility stuff. It's really wonderful for helping women, who I have quite a few in my practice, are in their 30s that are trying to get pregnant for the first time and are struggling, or even not struggling. It's a great kind of preparatory herb for that process as well. So yeah, Vitex would be it. So yeah.
No one else has picked that herb, and that is such a great herb.
Yeah.
I love it. What a great choice. So how can people find you, other than, of course, everybody on ND Live once a month? So check the public calendar to find out when you could talk in person with Dr. Cole, but how could they find you to make an appointment?
Yeah, my website is the first place to go. It's just draliciacole.com, and I'm excited to certainly offer, in-person consults. I do take insurance, but I just am getting going with telehealth visits as well, so I can see people wherever they're at around the world. Basically, they can make those appointments right through my website as well. So, yeah.
Wonderful. Well, listen, thank you so much, not only for the time you take to participate in ND Live and talk to people, but taking the time to talk to us today, and for your dedication and passion. Oh, you know what? Before we go, there was something I wanted to ask you about.
Sure.
You have a few more minutes. I know I said this would be quick.
No problem.
So, there's this, and this used to happen a while ago, and then it calmed down for a while, and now it's happening again for me. I have a lot of patients coming in, and they are finding these great special deals on their supplements and vitamins, and they're buying them at Amazon and Walgreens and Walmart. And I am really having to do a lot of education about why that may not be the best thing. That's maybe not what's in the bottle, right? If they buy it on Amazon. What are you finding, and what are you telling people? How do you solve this? What do you do?
Right. Yeah, I agree. It is a challenge, because the media certainly has that bone and is, running with it. I have the benefit of coming from, an educational institution that my clinical training, the supplements that were allowed in our dispensary they were vetted, left, right, and center. Those companies were meeting all the standards of clean production, clean ingredients, organic whenever possible. They are meeting standards that, which we know European standards are much higher than those in the US. And so they were making sure that they were meeting those standards. And so, I really gravitate towards a lot of those supplement companies first, because I know that background check has been done. And luckily, I also have the ability to use FullScript, which is my online dispensary. And the companies that FullScript offers, some of them are available through like Amazon and things like that, but a lot of them are available only for professionals to prescribe directly to patients. And so, and again, those are those really top tier companies where they are going to provide the highest quality so that I know I'm hitting my therapeutic doses when I'm trying to prescribe to patients versus taking, 15 fish oil capsules, hoping that maybe you're going to get to that 2-gram dose,
Right.
Patients aren't going to do that. So, and not, let alone, like you said, being wary of the soy and the corn and the colorings and the additives that just are not good for our bodies. So yeah, so I use FullScript, exclusively for my dispensary right now. My patients love it, and I know that the quality control is really there because they're making sure that who they work with and the products that they provide are top notch. So yeah.
I just started using them a couple of months ago, and I've been super thrilled at how easy it is for my patients to
for sure
get a recommendation for me and order it. Good. Okay, well, yeah, I had meant to ask you that. We had an interview the other day where there's a doctor whose patients are ordering almost exclusively from Amazon, and they're not really sure that what they're ordering is what's in the bottle.
Oh my gosh.
Because of their reaction to what they're taking.
Oh, okay. Yeah. Scary.
Okay, well, back to our wrap up. Thank you.
You're welcome.
Thank you for joining me, and I hope you have a wonderful holiday. And I'd love to have you back to maybe, talk about maybe a particular condition or something, a modality where we're talking very specifically about something, if you're open to that.
Yeah, of course, anytime.
Okay, great.
Yeah.
Thanks. I hope you have a great day.
Thanks, you too.
Bye.
Bye.
Visit medicinetalk.org to join us at ND Live today. And be sure to ask your doctor about FullScript.